Thank you very much for joining us today on the program Healthy Living. We do sincerely apologize for coming on behind time due to circumstances beyond our control. My name is Adisuwa Osapowage, and today on the program we're going to be looking at a lot of things, particularly that which affects the woman. We're going to look at gynecological disorder and how it affects fertility, how it affects intercourse, how it creates a lot of problems in the woman, and how, of course, we can find a solution to this. And the bottom line is that you must see a doctor as soon as you notice anything going wrong with you. So to look at this issue, we have a doctor in the house. He is a consultant gynecologist, also a fertility expert. He was the former medical director of Central Hospital and of course the CMD of Fountain of Life Specialist Hospital here in Benin City. Dr. Jerry Osawaifu, it's nice to have you join me today.
It's always a pleasure to be here.
All right, when we talk about gynecological disorder or disease, what are we looking at?
Well, we are looking at things that are different from what we expect in a woman. Okay, you can start right from when a child is born. You know, you have what we call intersex problems. You know, you have a hermaphrodite. You have a child that is supposed to be a male but has female appearance.
Well, what is really the cause of that? You find a child who have both male and female organ. It
happens right at the time of formation. You know, the first 2 months of the first 7 days, okay, of development, once there's fertilization, a lot of things occur. Genetic materials are duplicating, baby is being formed, and you find that there's a place, a time we will call the indifferent stage, where you can even tell whether it's going to be a male or a female. So at that point, you find that a lot of little genetic factors will come in that may not make the whole thing ambiguous, okay?
Is there anything a woman can do to prevent such?
Well, pre-conceptual counseling is very important, and pre-conceptual care. And all these things are more common in people that have the risk factors, such as maybe family or genetic problems, or maybe some other congenital abnormalities, or medical disorders like diabetes, hypertension, hormonal problems, and so on and so forth. Okay, and then when you go beyond that stage, you now go on. The child is born, appears normal. Some of them may have what we call precocious puberty. That is, they get to maturation, starting their menses long before the expected time.
Wow.
It can also happen. These are problems. Okay. Then when you go beyond that, you now get to a stage where a girl gets to when she's supposed to start menstruating normally. She goes beyond. So we now call it, maybe amenorrhea means no period. So what we call primary amenorrhea. The girl that gets to 16, 17, 18, 19, 20, and yet no menses. So that will not make the doctor to go back and see how she is. Look at when she was born, how it was, the developmental milestones and so on and so forth. Just with an attempt to find out what is really responsible. Okay. And then for those that start, okay, go on.
No, you go on.
For those that start menstruating, then they can start having menstrual problems, menstrual irregularities. That's another very major, very common complaint among women. Either the menstruation occurs infrequently, that is, maybe very long before it occurs, or some occurs at 2 regular intervals. Normally, a menstrual cycle will take as normal between 21 to about 35 days. Okay. It's shorter than 21 days, then it's abnormal. Longer than 35 days, it's also abnormal. But also, in between, you have groups of women that have 24-day cycle. So which means they see their menses every 24 days. Okay. Then you have others that see their menses every 21 days. So 21 days is, those that see every 35 days is regular. Okay. So that pattern goes on like that, is regular. So, but by the time this month you see your period, within 2 weeks you are seeing your period. The next month, it takes a longer time, 45 days to see it.
You know there's a problem.
You know there's a problem. But unfortunately, a lot of women, you know, tend to stay at home at that stage, and they don't seek medical advice or medical attention promptly. Then from there, you now have those that have very heavy menstrual bleeding. Okay, they have a very heavy menstrual bleeding that will bleed so much, they pass clots of blood and so on. So there are quite a number of area of things. Then when they go beyond there, when you go beyond there, when you go beyond that, you now see women, okay, that are having what they call infertility. They get married, they are trying to get them. What is the cause? What's the problem? You know, then a doctor will try to find out. But even among normal couples, if you take a 100 couple, for example, okay, they get married to, they are normal, everything appears normal. You know, not all of them will get pregnant in 1 year. Okay, only about 85% or so they actually achieve pregnancy in 1 year. So for that reason, that's why we say most women, except there are other factors, if everything appears normal, then we may say, okay, fine, just be patient and wait. Everything is normal. You know, but once it's after 1 year, that's when we start investigating. So that's why we define infertility as inability of a couple to achieve pregnancy after 12 months or 1 year of unexposed regular sexual intercourse. Okay? So, and you find that even after 1 year, there will still be like 77% of the 100% that may not even get pregnant, even though things are normal. So, what we'll try to narrow it down to today, because there are so many, you have an array of problems. Oh, I left out one very important one. Okay. That is so common, fibroid. Fibroid is a very common thing these days among women, but that will be a topic on another day. But it has its own role to play too in infertility. So when we are discussing infertility, we may have to talk about fibroid to some extent. So infertility, if it occurs, to the doctor, the patient comes to you and says, oh, I've been married for more than 1 year, yes, pregnancy is not coming. Then you try to find out why. Okay? Now, is it the woman or the man that is having a problem, or both of them? You know, hitherto, we used to say that the female, this was much more in the female than males. Male factor alone, they account for like 45%. Then, female factor for up to 45%. Male factor for about 30%. And then the unexplained, the remaining one. Those are one cannot really explain. But now the trend has changed. It has changed. You see, in my own practice, most times when I see about 10 couples, up to 7 of them, 7 out of the 10, the male factor will be there. Up to 7 out of the 10. So which means male factor is becoming very, very important as well. But we will try and break it down. We will take the female infertility first of all. Okay, now, what are the possible causes of female infertility? That's the question you will ask.
Yes.
Now, for a woman to get pregnant or to conceive, she must have an intact womb, okay, that can hold the baby. Okay. She must have tubes that must be free and not blocked. Okay. Then you fallopian tube, yes. Tube. And then you have the ovaries that are functioning normally, which means they are working well, producing eggs, and eggs are coming when they should come. Okay, and then outside that, you may have other factors that are related to these ones that may influence them. Okay, so but if you take them one by one, it's good to take them one by one and find out. And
what the problem is.
Yes, but usually what we do, we take a very good history from the couple. We like to see the couple together if possible, the male and the female together at the same time. Then you ask the woman questions, okay, about when she was born, how old she is, but we know age has a role to play. Okay, when a woman gets older, from 35 upwards, the quality and quantity of egg they have starts dwindling, starts going down. And by the way, when a girl child gets to the age of menarche is the first menses a woman sees. Okay, at that stage, you know.
Like at what age should the woman start seeing her menses?
Well, usually these days, maybe because of good nutrition, for about 13, 14, a lot of them are already seeing their menses.
What about when a 9-year-old girl starts seeing her
period? That would be precocious. That would be called precocious puberty. That is occurring long before the time. I mentioned earlier on, you could have what we call precocious. But one may have to examine and find out why. Does she have any hormonal problem? Does she have any other disorder that we're not seeing? Does she have a tumor or mass that is producing those chemicals that make a woman menstruate, estrogen, progesterone, and so on and so forth? We have to be very careful and to find out if there's any problem. Otherwise, on the average...
Because sometimes you hear women complaining, you know, like when you go for school run, you know, it's like a gathering of women, and then you hear women talking about their 9-year-old, 10-year-old, saying their period, and it gives them cause for concern.
Well,
but they just talk about it and let it go that way.
Well, you see, if it's early, it's good to take a good look at them. You see, if it's early, 8 years, 9 years, that's a bit on the early side. Okay, because it follows stages. First of all, you first of all notice breast bulbs trying to come out. That's the first one. From there, you now have pubic hair. Okay, you now have pubic hair. From pubic hair, later she now has axillary hair. Okay. Okay, the breast develop more. Yes, the breast develop more, become well formed, and the first one is a late event in the process of pubertal period. It's a late event. So if it occurs much earlier, yes, or the other, then we will call it precocious puberty.
What about in a male, in a boy?
To have a breast.
No, that is, when does the boy mature?
Oh, the boy matures usually from around 14, 15, 16. They are already ready to go. So a 15-year-old boy can make a woman pregnant.
Okay, let's look at the issue of increased vaginal discharge, because a lot of women complain about that.
Yes.
Like the text messages we got on this program, like some women will say, okay, they do not have children, but they always have this serious vaginal discharge with plenty of pains and sometimes with odor. Does it have a role to play in the reproductive
Yes, of course, yes. Although to discuss vaginal discharge, that's a whole topic for a day, and I think we should devote a day.
But does it have anything to do with this?
Yes, if a woman has vaginal discharge, we look at it. It could be pathological, it could be physiological. Okay, for example, the ones that are normal. Normally, every woman has discharge that is normal, usually not offensive. Okay, and it changes with the time of the cycle. You will notice that around the time a woman is about to ovulate, she has a kind of discharge that is slimy, that looks like kata. Like if you touch it, you can stretch it between your two fingers. It's light, like the egg.
Yes.
That is not boiled here. That white part of it, it looks like it, or kata. You can stretch it. Then the moment the woman ovulates, the discharge changes from that slimy thing to a thick white discharge. Okay. Then again, you're not talking about whether it is really much or just okay. So that's the normal vaginal discharge. But normal vaginal discharge can increase in women that are taking other contraceptive pills. They may see it a bit more, the volume may be more. Or women that are pregnant in early pregnancy, because the pregnancy has to do with a lot of hormones. So they produce more of that normal discharge.
Without odor? Without
odor, yes. It will be normal. So outside that normal discharge, you could have pathological discharge. And in most cases around us here, is infections. It could be bacterial infection, it could be yeast infection with candida, it could be viral, and so on, and it could be what we call amoebic, and so on, all kinds of things. So the approach to it, because all this one, if it's infection, it can affect the woman. Okay. The infection can ascend, can cause problems inside the womb, can go on to affect the tubes, and the tube can get blocked, okay, either partially or totally. If it's partial, that woman that has a partial blockage may be prone to having what we call ectopic pregnancy. The sperm can pass through, fertilize the egg, but the egg will not be able to pass through and go back, and then the egg gets stuck in the tube and start growing. So you now have ectopic pregnancy. So infection should be viewed very, very, very seriously in any young woman. In most cases, when they have it and they have pain along with it, okay, and the other criteria that we use, we say they have pelvic inflammatory disease, which must be treated vigorously and seriously, because it may be an event that will just ruin that woman's life, destroying the womb, causing what we call intrauterine synecdoche. Synecdoche means inside of the womb is planted together. Okay, so how can the baby stay there? That's the problem. Or it can go on and affect the tubes and block the tubes. Or it can go on, spread from the tube and enter into the pelvis of the woman and cause some problems that may give the woman what we call chronic pelvic pain that the woman may have to live with.
The problem now is this: what are the signs? What are the signs women should look at for? Because most women will just feel something and say, let me take antibiotics.
No, that's wrong.
Or they feel anything, let me just go and sit on hot water. Everything will wash out. It gives a cause for concern. What signs should a woman look out for?
See, let me tell you, infection, we're not talking about infection alone. There are other things. Having a discharge may just be a signal that there's something terribly going wrong. Like cancer of the cervix may begin with vaginal discharge. So if you don't see a doctor, how will you know? If you sit on water, how will you know? So a woman that has any form of discharge should go and see a doctor. Let the doctor take history from you, examine you, and if possible, do some investigations to find out why you're having that discharge.
So apart from the discharge, what about, so women have complained about burning sensation, they have this, they urinate frequently, you know, all sorts.
You see, a woman urinating frequently will point to two things, okay? Either of two things. Either she's having problem with sugar, okay, then there will be other problems along with it. There will be other symptoms, like she'll be drinking water excessively as well, and passing water excessively, okay? And then most times she'll start losing weight and having a loss of strength, okay? Then that your mind will go to diabetes.
Okay.
But if the woman is now peeing every second, and she has what we call frequency and urgency, she pees now, then the next few minutes she feel like going again, and then it will be such that if she doesn't hurry to go and quickly ease herself, she will just wait herself. That feeling will be there. That's what we call urgency. And then pain. Those three symptoms: frequency, urgency, and pain. So those three point towards a urinary tract infection. So in most cases, when you have that, your mind goes to an infection that is affecting the urethra, that's the pipe through which urine comes out, the bladder that controls the urine, and so on. And it may even ascend up to affect the ureters going to the kidneys, okay, as the case may be. Now, so the thing to do is, any woman that is having anything that is different from a normal thing should see a doctor, preferably a gynecologist. That's the truth. If you have a discharge, you don't know what's causing it. You don't know if it's an infection. You don't know if it's
there is this thing about most women.
Yes.
Women, such a condition comes like burning sensations. They have this thing, the thing is toilet disease. And they are running to the chemist to get one antibiotics or the other.
Okay, now if you don't
get some cream.
If you don't to the chemist, who do you see in the chemist? You see people that have not even gone to the university. People that just trained how to sell drugs. And with time, you don't have vaginal discharge, you put this pastry there. They give it to you. But meanwhile, what is causing your discharge will be something else. Maybe something else. Maybe it's cancer. They're just starting. And they give you a pastry to insert. So a doctor has to look at you. Look at the discharge you're having. Is it yellowish? Does it smell like fish? How does it smell? What's the color? What's the texture? Does it scatter like gari? Is it like milk, smooth like milk? That gives the doctor an idea. The doctor will go out and take a look, okay, at inside and see where it's coming from. Is it coming from inside of the womb? You see the opening into the womb from the cervix, or just coming around the vagina. Okay, if it's coming from there, then doctor will now probably take a swab of it. After checking and making sure the cervix is healthy, it will do so many things with that examination, taken by the cervix. And that reminds me, there was a case I encountered some time ago, of a young woman that had vaginal discharge for about 7 years. That was going from chemist to chemist, buying drugs.
7 years. 7
good years. Inserting all sorts of things, you know, and the thing never stopped. What was responsible for it? You know, she was using cotton wool as pad, and she would stick it into her body during menstruation. A part of it broke up and remained there. And that was the cause of the discharge. So foreign body is a cause of persistent vaginal discharge. So that was her problem. So once I took a look and I saw that there was something there, I just removed it and we were able to see that it was cotton wool. So we just treated her and that was the end of the discharge. So that again, you know,
women should be careful the kind of stuff they use.
Yes. You don't really encourage people to be putting cotton wool or whatever. You can break, or even tissue paper. Why should you use tissue paper for as pad? It's very wrong. Use an external pad. It's very simple. Put it there and wear your disposable panty or whatever over it. And then once you are changing, you change it and throw away that disposable thing. Okay?
All right, the program is Healthy Living on ITV, and we have Dr. Jerry Sawaipo with us here. And if you have any of these symptoms or any of this, or you may have one or two of what we've been talking about: burning sensation, vaginal discharge, you name it, frequent, urgent, and then pains when you're urinating. It's time for you to call the doctor, and the number is 052-290-571. Give the doctor a call. If you can't use 571, use 573, okay? Call him, ask questions. You never can tell, because the problem is this. After the program, you find a lot of people trying to reach out to me, calling me. I am not a doctor, okay? The doctor is here seated, so give him a call, ask him questions, every question that you need to ask. And but adventure, you're also a man who is suffering from infertility. It's time for you to ask a question, okay? It's not about the woman all the time, because the woman has suffered enough, okay? When it comes to infertility in a family, oh, the woman can't bear children, it is the woman's fault. No. Call a doctor, ask him a question. There might be something you're not doing right, okay? So give him a call. So while we're waiting for those calls, doctor, let us look at the commonest gynecological problem, the one that is very common. Which of it?
Well, the one that's very common is menstrual irregularities, but I think we should dwell more on infertility because infertility is becoming very common.
It is very common, we know.
Very common, becoming very common now, and it is alarming.
Let us look at infertility in men, because when it comes to infertility, we are quick to point fingers at the man, at the woman. So what are the causes of infertility in the man? Okay, fine. For a man to be declared as okay as regards fertility, okay, we do a simple test we call semen analysis. Okay, the semen analysis, there are factors that you look out for. Number one, you have to look at the count of the sperm. Well, hitherto we used to say minimum of 20 million, okay, cells per male. But now we have seen that even some men that have lower sperm count, but good quality sperm, can make their wife pregnant. Yes. So that 20 million has now reduced a little bit. But even at that, you have a lot of men are having issues with fertility, having low sperm count, less than 1 million. Less than 3 million. Let's explain some of the causes. Yes. Because we cannot do all. We cannot do all, yes. No, but it's good for them to understand these basics before we talk about the causes. So you find that, you look at the quantity and quality. The quantity is the count. The quality has to do with what we call morphology, that is how the sperm look. Morphology. Okay, is it the normal shaped sperm, or is it a sperm that has two heads, or the one that has double tail? The one that has a very short tail. Yes. Have two heads, tail and sure. Okay. So these are abnormal. So they count and try and find out the percentage of that are normal. Okay. The percentage of normal one shouldn't be less than 60%. Okay. Oh, I think we have a call. Hello, caller. Good afternoon. Hello. I guess we lost that. Hello. Yeah. Good afternoon. Who is talking to us, please? Okay, Monday, quickly ask your question.
Yes, the question is not seeing her basics. What is the cause?
If a woman is not seeing her menses, what could be the problem?
Yes.
Has she ever seen the period before, or she has never ever seen it before?
Yeah. She has given birth twice, but the thing is totally stopped.
She has given birth twice.
How old is the last baby?
The last baby is 4 years.
When did she stop breastfeeding?
It was a year plus.
A year plus. Okay, fine. You see, what is difficult, it's difficult to give you a straight answer because there are many factors that can be responsible. Number one, that delivery. How was that delivery? Was it a normal delivery?
Yes, it was a normal delivery.
Okay, was it in the hospital?
Yes.
Okay. After that delivery, did she have any problem?
But the first delivery was with operation. Hello? Yeah, I'm hearing you.
Okay, the first delivery was through operation?
Yes, the first delivery was through operation.
Second one was normal?
The second one was normal.
Okay. Now, since she's breastfed for a very long time and she stopped breastfeeding not too long ago, I think the first thing that I would like to check is to see if she's still lactating. Okay? So it's very simple. Let her she will just squeeze her nipple and see if breast is coming out because no, she's no more breastfeeding. If she's still lactating,
breast is coming out from the nipple. Breast is still coming out from the nipple.
It's still coming out? Okay. That may just be simple, is it? Okay. Then let me explain how it can be. Okay? As she's having that breast milk coming out, it means there's still a chemical in her body, a hormone called prolactin that is still high that controls and regulates breast milk formation. So if it's still high, it suppresses ovulation. It suppresses egg development in the ovaries. And if eggs don't develop, the wall of the uterus that is supposed to build up to eventually lead to menstruation will not occur. And if there's no ovulation, no egg production, she will not menstruate. Okay? So since you have been very simple, try and see. I cannot start prescribing to you on air. Okay. Okay. So it's a very simple thing. It reminds me of a couple I saw that had that problem for 10 good years, and they never saw a good doctor. They just came, so like magic. We saw that was the problem. We gave her a drug. The very next month, she got pregnant. She got pregnant. So that problem was just that she was having inappropriate lactation, and then that was linked to the fact that she had high level of that hormone called prolactin, and that prolactin suppresses ovulation, no egg production, no formation of the womb, like baby is going to stay, no menstruation.
Wow. All right, people, the number is still very much available, 052290573. Please give the doctor a call. You have to call the doctor because when he leaves, I will not be able to do much for you. So call him, ask questions. So we're looking at infertility in men.
Yes.
And you just said that a lot of reasons can be can be attributed to it. We've talked about sperms with two heads, two tail,
So we look at the quality and quantity if you do the semen analysis. Okay, the semen is the water plus the sperm. Let me put it right. So women will come and tell and say, after meeting my husband, everything will just come out. In most cases, the sperm is already gone because there's a liquid that carries the spermatozoa, and that liquid is just a vehicle that carries it there. And once the sperm gets there, they swim out of the water and then they start going up and looking for the egg to fertilize. So what comes out at the end of the day is just like a vehicle carrying passengers to a location. And when the vehicle gets there, the passenger comes down from the vehicle and then the vehicle returns back from where it's coming from. So that's just it. So it's not as if maybe everything comes out. Now, those things, like I said before, the quality will have to do with the shape and type of sperm cells that you have, and then also the what we call motility. Motility, that is the sperm that you have. Do they move the way they should move? And the one that can produce pregnancy is the one that have what we call forward progressive movement. They keep just going forward. Okay, you may have some that will be spinning around one spot. They cannot go and hit the target. There will be some that will be swimming backwards instead of moving forward. But that one, those that are actively motile and are forward progressive should be not be less than 25%. Okay, but for motility generally should be less than 60%. If it's less than that, that will reduce the fact that they won't be able to achieve fertility easily.
Okay, let's begin to this call. Hello, Kala. Good afternoon.
Good afternoon, ma'am.
All right, what's your name?
I'm Peace, my name.
Okay, go ahead, Peace.
I wanted to have, I do have this hotness of body.
I can barely hear you, Peace.
Okay, I said I do have hotness in my tummy, very hot.
You do have what?
Sometimes I'll feel as if there's a baby in my womb that is palpitating.
You feel like... Hello, Peace.
Ma?
Okay, what did you say? You feel like what?
I said I do feel hotness in my lower abdomen, very hot.
Okay, hotness in your lower abdomen.
Yes, abdomen. Then it will pain me to the backbone.
Okay.
Then when I lie down, I will as if there's a baby palpitating in my tummy. I have done scan 3 times. They said there's nothing wrong with me.
Okay. So you want to know what could be the problem now?
You see, when we talk about scan, you see, the scan is an equipment that you use to do many tests. I did a scan. Scan is ambiguous. It doesn't tell me exactly what that scan was used to do. That's the point. And then if you are doing scan, the scan can be done, and then you just see it's like see you now, the way you are. I take you a picture, but I don't know what is inside you. Okay? Then, but there are things you can also do with the scan to see inside you and see what is wrong and what is not wrong. So doing a scan and saying there's nothing,
it's not enough.
It's not enough. Okay, you need to go more than that. And again, you should start from scan. A doctor may even pick why you are having that problem, just looking at you, examining you. Okay, just examining you. So a lot of people get it wrong. They walk straight to the scan and say, I want to do scan. You have missed it.
Perhaps she's not seeing a gynecologist.
Yes. So the first step is to see a gynecologist. He will ask you questions. Your history, your menstrual history, your sexual history. Have you done abortion before? Have you had miscarriages before? Have you had an infection before? Have you had a bad discharge before? And things like that. From there, the doctor will be able to start putting 1 or 2 together before he now examines you. By the time he examines you, the picture is getting clearer. And then they go further to do tests. Not just scan alone. He may even do a swab test. It's not everything you can see with the scan. You can even do a swab test and find that you have an infection. Okay, that you have been using drugs to suppress. You have been buying drugs across the counter, buying tetracycline and flagyl across the counter and swallowing. Then, when you do that, those drugs will modify the symptoms for you.
Okay.
It will not present it typically. And that will deceive you. You think you are okay, but you are feeling some discomfort. Meanwhile, that problem is there and it's causing destruction. That is supposed to happen.
Not supposed to happen.
Yes. So the point is that, my dear, I would just advise you, go and see a gynecologist, okay? And you'll be amazed at what will unfold by the time you are thoroughly checked.
All right, Peace, I want to to ask you to stay on because I may just give you a follow-up number, okay? All right, hello, caller, good afternoon.
Hello?
Hello, good afternoon. What's your name?
Hello?
Hello, good afternoon. Please tell us your name.
Hello?
Hello, I can hear you. I can hear you. All right, when you're calling, reduce the audio level on your television set or move away completely from where your television set is, and then we'll be able to talk. Hello, good afternoon. Hello? Hello? All right, the line seems to be jamming. All right, Doc, let's just continue with what we're talking about.
Yeah, we're talking about male infertility. You know, so I said quality and quantity.
Quality and quantity.
Quantity is the count.
Now, how do you test for the quality and the quantity of sperm?
It is a lab. You microscope to look at it.
Hello, caller, good afternoon.
Good afternoon, ma'am.
Good afternoon. Please, what's your
I
name?
have a younger sister who has not seen her period since she grew up.
I can't. Hello?
Hello, good afternoon.
Okay, let's start again. Yes.
I have a younger sister
Okay.
who has not seen her period since she grew up.
Okay. So how old is this, your younger sister?
She's 37 now.
37.
What could be the cause?
And she has never ever seen her period?
No.
Doctor.
Well, why has she waited till this time? Because certainly if she has seen a doctor or a gynecologist, by now they would have known why she's not seeing her period.
Yes.
And then,
It
would have been indicated earlier on, and probably something would have been done before now. Well, it's not too late. Let me give you hope. It's not late. You can still see a doctor. Okay? So one can find out why.
Not just any doctor.
Yes, like I was telling you at the beginning, you have what we call male. What do you call there's a name we give to it. Okay. You know, a male that is looking like a female.
Like a female.
Yes. Where from breast, good shape.
That's an hermaphrodite now.
No, hermaphrodite means you have the two.
You have the two.
Yes, you have problem. You don't have what do you call I forgot, there's a name we will call it. Okay. You know, but the point here is that genetically, the person is a man. But somehow during that development stage, that first early stage I talked about earlier on, something went wrong.
But she has all the features of a woman.
That's what I'm saying. But inside, she doesn't have any ovary.
Wow.
She doesn't have any ovary. She doesn't have any vagina. With the vagina ended blindly. Okay? It will be there outside, but inside, because they are formed for two different sources. Okay. The inside and the outside. The inside is formed for what we call the Mullerian, whatever. I don't want to get big names. Then from the outside, another one comes from below, from two different sources. Okay. But they now meet at the end of the day, and there's canalization to join them. So, if something goes wrong, the inside will be male, but outside will appear feminine. You know? So, if that kind of person comes, then the first is to test, check the karyotype, that is, the genetic makeup. Is it a male genetic whatever he has, or a female? Yes. You have XY, you have some super female, XSY.
So in the case of this lady that just called now, what can be done about this kind of a situation?
Is to take history from her, ask her questions, how she was conceived, how she was born, then examine her from head to toe. Okay, and after examining her, then examination will be part of examination will be to look at all the features. Some of them you will see they will have breasts, but no hair, no pubic hair. So they don't have any axillary hair, and so on. You know, there are quite a variety of these intersex that you have. We call them intersex. All kinds of problems that may arise. But again, it may not even be that. It may even be that there's ovarian dysgenesis. That is, the ovary just refuses to form. Without the ovary, there's no way a woman can menstruate. Because the process of menstruation has to do with egg development. Every month, the woman sees her period. That cycle starts from the day the period starts. From that, the eggs start growing in the ovaries. As they grow, they secrete a hormone called estrogen. That estrogen goes to the womb to start preparing the womb for a possible pregnancy. If that egg is released and fertilized. Now, it gets to a point where the egg is released, that's ovulation. What is left of the egg, the shell, now organizes itself into an entity called corpus luteum. That will now start producing another hormone again, progesterone. That will now make that womb ready for a possible pregnancy. So if that egg is fertilized, that baby comes back and stays in that womb that will be prepared. Now, if there's no ovulation, all this will not happen. So the womb will not be formed, nothing there, no egg is coming, and then no menstruation, because it's when there's no fertilization, that womb that has accumulated, that is shared as menses at the end of the day, and it occurs in cyclical pattern every 24 days, every 35 days, as the case may be. So if the eggs are absent, That's ovarian degenesis. Okay, it's not there at all. You get it, or it's not properly formed and so on and so forth. Then the woman may be female, but the ovaries are not there. You know, all those ones. Then we have options, fertility options for such people. Okay, if the womb is okay, everything is fine, then we may think about donor egg. You know, there are quite a number of things. Maybe we'll talk about people with fertility next time, so to give some people hope.
Okay.
There's almost nobody that cannot carry a baby now. Now, the way it is, there are many things that can be done.
All right, let's quickly take this call. Hello, caller. Good afternoon.
Hello.
Hello. Good afternoon.
Hello.
I can hear you. If only you will speak up a little bit. Speak up a little bit, please.
All right.
Okay, so what's your name?
My name is Blessing.
Blessing. All right, Blessing, ask the doctor a question, please.
You know, over 10 years, I've seen my period, but I have not conceived. Over 10 years, I have one issue. I have not conceived. What is the problem?
Okay, you have a child.
I have, yes.
10 years after.
Yes.
You've not been able to
now.
conceive.
Yes.
But you're seeing your period regularly.
Yes.
Okay, how many days?
What is the
Your
problem?
period, is it every 28 days, every 24, every 35, every 30?
Yes.
Yes, which one?
28 days, 30 days, 24 days, which one?
28 days.
Okay.
Days.
Okay, now I'll start by asking you that last delivery you had, because you got pregnant and you delivered. Did anything happen? How did you deliver? Was it a normal delivery or an operation that was done? Operation. Okay, operation was done. Okay, so if the operation was done, after that you're not able to conceive, it will be good for the doctor to examine it to make sure everything in your womb is intact. Okay? And then also look at other things. Where the ovaries are producing eggs, or whether you are having this thing we talked about before, you are having inappropriate lactation and things like that. So you find that you have to see a gynecologist. That's the bottom line. Okay? If when you see a gynecologist, then he will be able to look at you from head to toe. Ask you questions about the last years you did. How was it? How many did you stay in the hospital? Did you only give in 7 days, or were you kept in the hospital for longer than 7 days? That will tell the doctor that you may have had an infection or something that made the doctor to keep you for longer than 7 days. Even if I had a normal cesarean section, she don't stay in the hospital for more than 7 days. These days, 5 days you can even discharge them. You know, so by the time you say, the woman tells you she was in the hospital for 2 weeks.
Then you know there's a problem.
Something must have happened. That's why she kept in the hospital for 2 weeks. So we need to find out. Then the doctor will go ahead to even examine you to find out is there anything wrong with the womb. Are the tubes okay? Are they blocked following that or surgery? Or are the ovaries still producing eggs? Or even the man, okay, your husband, it may not even be you.
Is it possible for a man to become infertile?
Yes, sure. Yes, I've had practical examples of a man got the wife pregnant, they had a baby. A year later, they said they wanted to rush their babies. They started trying, it didn't come. Okay, man, you come. Say, but just 1 year ago. Let them just do the test. We found that the man was the one that was having the problem.
What could have been the cause of such a situation? Anyway, that's the question you're going to answer when we come back.
Okay.
Because time is not our friend.
Yes.
All right, for those of you who want to do a follow-up, because I know a lot of people have been trying to call us on this topic, gynecological disorder. It can happen to a man, it can happen to a woman. So it's not a woman's thing, because some people will say, I beg, now woman problem. It's not a woman's thing, okay? It can happen to male and female. And doctor have also told us now that a woman may have all the features of a woman. You have breasts well formed and everything, but inside there is a serious problem going on that you cannot detect, or that ordinary scan will not be able to tell you the situation of things. So with this, I would like to call out these numbers for you to do a follow-up, okay? Do a follow-up. Give us a call on this number after now, 08039506666, okay? Give us a call on this number, 08039506666, okay? It's a very easy number that you can always remember, 08039506666. So give us a call on this number to do a follow-up so that we'll be able to help you. And this is all we're going to do today. We thank you so much for being part of it. We'll see you again next week with Dr. Jerry still in the studio with us. Until then, please stay healthy. Bye for now.
Bye.